Sudden death is basically defined as death after the 24 hours of an emergency. Now, according to this WHO definition, death if it occurs after 24 hours of an emergency state, that is defined as the sudden death. But this 24 hours is sometimes considered to be a very long period for a lot of pathologists. So they basically consider death that ensues after 1 hour of an emergency state that can occur in an individual is considered to be the sudden death of an individual. So this is what we are dealing with in this section over here. And basically, we'll be dealing with the reasons for this unexpected death. So moreover, we'll have to basically emphasize on the fact that it is not only the unexpected death, but basically it is the unexplained death that we are talking about right now. Sometimes there are the diseased conditions in a person that can basically relate to a certain death, but that cannot really explain quite well why the death of an individual occurred, because he or she was suffering from that chronic disease for a very long period of time and he was dealing with it. So what basically were the sequence of events that led to the death of the person in a particular state? So that is what we'll be discussing over here. The underlying causes will be discussed over here. One has to basically keep in mind that basically the trauma, the infections, the neoplasms, and the environmental conditions are all basically putting on an additional factor or an additional stress on that particular person. And that basically lays the foundation for the death of that particular person. So as we are dealing with any crime scene or as we are dealing with any other investigation, same is the case over here. We'll visit the crime scene and the environmental conditions are even recorded for in that particular case over here. So in this section, we'll be focusing on the fact that the sudden death from the ruptured cerebral aneurysms that will be discussed over here. And moreover, we'll be discussing the sudden deaths in the epilepsy. Cerebral aneurysms, I would like to emphasize on the fact that we have to keep in our mind, for example, it can be the Barrett's aneurysms, and they're usually the birth defects and they remain undiagnosed for a whole lot period of time in a person's lifespan. So sometimes the relatives will give you a history that so-and-so person was basically fine, he was hale and healthy, and he was all right. But at the back of your mind, you have to keep in your mind that there are a lot of birth defects that remain undiagnosed for a certain period of time. So we have to keep in our mind that these Barrett's aneurysms, they remain undiagnosed, and on the rupture of these aneurysms, they cause a lot of damage to the brain. And for example, if they are involved in the circle of Willis, that is the main blood circulation involved for the brain, these Barrett's aneurysms, when they rupture, they cause a lot of hemorrhage, subarachnoid hemorrhage that can be a cause of death in a particular person. Talking about the sudden death in epilepsy. So epilepsy is basically a condition in which the electrical charges are magnified for a person, and that can also prove to be fatal in particular conditions. Obviously, it is not a fatal condition in itself, but the additional factors, the stress factors along with this epileptic conditions, for example, if the person follows a trauma, if he slips into the bathtub or into a fire after an epileptic seizure, that can prove to be fatal for that particular person. Moreover, we will be talking about the genitourinary system, specifically the pregnancies and the abnormalities related to the pregnancies can prove to be fatal for a lot of women. I'd like to quote that there are a lot of conditions in which there is an ectopic pregnancy, that is, the pregnancy is not basically lying in the cervix of the uterus or in the walls of the uterus and is ectopically or abnormally lying in the tubal ligaments. So that can sometimes rupture in a lot of cases. A lot of hemorrhagic reactions occur after this rupture of the ectopic pregnancy, and that can sometimes lead to pulmonary embolism or thromboembolism conditions that can prove to be fatal for the women, of course. So over here, basically, we are dealing with the sudden or the unexpected deaths, and over here, the underlying causes are highlighted over here in this flow chart. First of all, the cardiovascular system, as we were already emphasizing upon, the atherosclerotic phenomena, in which there is a thrombus formation, and there are a lot of complications that can occur in this thrombus. For example, there can be a rupture in the thrombus, there can be a hemorrhage in the thrombus, and there can be the dislocation of the whole thrombus itself, and that can lead to a pulmonary embolic phenomena. So all of this underlying pathology, obviously we're not dealing with the pathology right now, that is above the scope of this lecture, but we are just dealing with the causes or the underlying mechanisms that basically relate to and form the foundation of death in a particular person. Now, the massive cerebral hemorrhages we were already focusing upon, that can result after the rupture of the aneurysms that were already present in a particular person, and it can also be resulted after a hypertensive stroke reaction, as well as it can occur after the traumatic conditions or direct trauma to the head. So all of these are basically going to relate to the massive cerebral hemorrhagic phenomena over here. The subarachnoid bleeding is another phenomena that we're going to deal with, and subarachnoid is basically the space between the pia and the dura mater of the brain, and it is usually filled with the cerebrospinal fluid, and the veins and the arteries of the brains are lying in the cerebrospinal fluid in this free space. So sometimes what happens is this space, or the subarachnoid space, is filled with blood, and that is basically called as the subarachnoid, or termed as the subarachnoid hemorrhagic phenomena. Then, of course, as we already dealt with in the ruptured ectopic pregnancy, it is one of the consequences that can occur, and it is one of the emergency situations that can occur in such a state. Then hemoptysis, obviously the underlying causes there are a lot of underlying causes for this hemoptytic phenomena. It can be tumors or carcinogenic reactions that can deal with this hemoptysis, as well as it can be some chronic infections, for example, tuberculosis. It can or pneumoconiosis. It can result in the hemoptysis, that is blood on sputum or blood on cuffing. If it is produced, it is known as the hemoptysis phenomena. So hematemesis is another thing, that is basically the blood in the vomitus of the person, and that can sometimes prove to be fatal. So itself, hematemesis is not fatal, but the underlying conditions are going to add upon it, and they're going to aggravate the situation over here. Then the pulmonary embolism, it's again one of the phenomena that can prove to be fatal in a particular person as well. Obviously, these pulmonary embolisms are resulting from the dislodgement of the thrombus that was formed somewhere. That is basically the DVT, or the deep vein thrombosis. Then we'll be dealing with the aortic aneurysms. So aortic aneurysms, they can be the birth defects, for example, the Barry's aneurysms, or aneurysms at the circle of Willis. All of these are basically proving to be fatal in a lot of conditions. Now, heart diseases, of course, there are a lot of heart diseases. It can be the birth defects, as well as some of the acquired malformations that occur in the different pathological conditions. So all of these are basically laying the foundation to the sudden or the unexpected deaths. And as you can see, there are a variety of systems involved in the pathophysiology of sudden death. So basically, the subarachnoid hemorrhages, it results from the chronic inflammatory diseases over here, and the most common cause of death over here that we are dealing with is the ruptured Barry's aneurysms, and that is the highlight of the sudden death over here. Now, the Barry's aneurysms, as we were already focusing on, they remain undiagnosed for a varied period of time in the lifespan of a person. So one cannot really suspect if a person is suffering from Barry's aneurysms or not. So usually the parents or the relatives will give you a history that the child or the person was symptomless and there is sudden death. So if you perform autopsy on the same person, you'll find out that there is a lot of hemorrhage due to the rupture of the Barry's aneurysms, and that will basically give you an idea towards the cause of death or towards the cause of the unexpected or the unexplained death. Now, the arterial blood impinging on the brain base, it's again one of the underlying pathophysiology over here. There is severe headache and a rapid coma ensues after this ruptured Barry's aneurysm over here. Now, at autopsy, what you'll be looking at is there is bleeding in the circle of Willis over here. Blood is spread down to the spinal canal, and the detection of the hemosiderin, that is a very important pigment that will basically give you an idea if a time period has been passed on after the hemorrhage. The hemosiderin is going to be there in the subarachnoid space, and that is going to give you an idea towards the cause of death. Now, the angiomas, the arteriovenous anastomosis, you'll just look at that and you'll just figure out that what was the underlying cause of death over here. The intracranial bleeding, it's another phenomena that will be seen in the rupture of the cerebral aneurysms. There will be blowout, thin-walled aneurysms. So it is one of the phenomena that will be discussed over here. Small aneurysms are quite difficult in detection because the hemorrhages are not going to be significant, and even on autopsy, you're not going to find out any hemorrhagic foci, or any hemosiderin cannot be detected after these hemorrhages because there is only a little amount of hemorrhage after these small aneurysms are ruptured. Blunt dissection is used for autopsy as a technique whenever you are suspecting this as the cause of death. Then the sudden death in epilepsy, as we were already focusing on the fact that it is basically the electrical impulses are magnified in the brain, and that is how the epilepsy is defined, or that is the underlying pathology in the epilepsy. A negative autopsy, whenever we are dealing with an epileptic condition and death occurs after the epileptic seizures. And moreover, it is going to mimic an asphyxial death. There will be engorgement of the veins, as well as there will be bluish discoloration towards the extremities, and that will basically highlight the fact that the death occurred due to a condition which mimicked an asphyxial condition, or the oxygen supply was compromised to the brain tissue and as well as to the other vital organs. So we'll be basically, for example, if the epileptic seizure occurs and the person is drowned in the bathtub, that can be an environmental condition that can basically it can be a positive factor towards the death, and that will basically highlight the fact that there was an epileptic seizure and the person was in the bathtub and he was drowned due to that epileptic seizure. Massive cerebral electrical discharge, this is the underlying pathology of the epilepsy that is highlighted over here. The investigations that are carried out in such a case are the toxicological screening. It's again one of the phenomena that has to be dealt in with. The samples are sent to the histopathologist, and he's going to furthermore comment upon the fact what were the toxicological symptoms if they are found in that person. Poisoning is suspected in a particular case, then we'll have to screen out that poisoning or the suspect of the poisoning after the sample analysis. Moreover, there will be a careful brain examination to find out any focal lesions, and the episodic hypoxia, for example, apneic states, if they were found, they're going to be looked for whether they caused any brain damage or they caused any damage to the cardiac tissue as well. So leukoencephalopathy, it's again one of the phenomena that is seen in cases of the epileptic seizures in the brains. There are basically white matter foci in the brain, and they're quite visible on the autopsy. Genitourinary system is one of the systems that can be involved as the underlying causes of sudden death or underlying causes of unexplained death. As you can see over here, it's basically a picture of a ruptured tubal ectopic pregnancy. And basically, ectopic pregnancy is defined as when the pregnancy is not stated in the walls of the uterus or in the surface of the uterus and is found somewhere else in the tubal tissues, and that is basically regarded as the ectopic pregnancy. Complications of pregnancy is one of the causes or the underlying causes that can be the foundation to the unexpected or the unexplained death. Ectopic pregnancy, when we found the pregnant tissue in an abnormal area, for example, the tubal ligations or in the tubal ligaments. The massive intraperitoneal hemorrhages are found in a case whenever there are complications of pregnancy. Induced abortions is one of the cause, and mostly they are the criminal induced abortions that are the underlying causes that lay the foundation to the death in the pregnant woman. Air embolism is one of the causes, and it can be a pulmonary embolism or a cerebral embolism that can be a cause of death in this case. Perforation of vagina and uterus whenever there is a criminal abortion and is performed by an untrained person or the untrained midwives. Sometimes the perforation of the vagina or the uterus occurs, and that can be a cause of death in a lot of cases. Infection and the use of the toxic substances. For example, the use of tampons can lead to a toxic shock syndrome-like state, and that is going to prove fatal for a certain individual. So in this section, basically, we dealt with the underlying causes of sudden death. So that is the end of this section. Thank you for watching scardio.com.